Hello there, fellow Baffords. This is Dr. Carlo Oger. I am a board-certified emergency physician, and I don't have any specific training in coding, but I have spent many hours studying, and I spent many hours with an expert coder of many years creating and then publishing a course helping optimize RVU capture for emergency physicians because I was under the pressure to improve my own RVUs as related to my employment. So I did learn a lot of things, and I think I can answer the question here by Eric Funk that was posted on EM Docs. The question was an RVU question related to cardiac monitoring and the interpretation of rhythm strips. And the question went like this: I found out today that our coders are not submitting the bill for lead rhythm EKG or cardiac monitor strips despite him doing a good documentation to bill for it. They are saying that this sentence, quote unquote, means that they can't, and the sentence comes from a CPT course that says you should not report a 93042 to indicate the review of telemetry monitor strips taken from a monitoring system. So the question is whether or not guys are being paid for ED cardiac monitor or telemetry. So the answer is absolutely you can bill for cardiac strips, rhythm strips, but they can't be just from the monitor. I mean, of course you're going to get it from the monitor, but it has to have a couple of elements in order for it to be billable. The first thing is there can't be an EKG on that chart. If there's an EKG, then the EKG bill will be submitted, and whether that EKG bill will go to you or the cardiologist, that depends on your shop. Most places, EKGs get billed by cardiology because they want credentialed to do so, even if it's unfair, even if they're doing after the fact. Doesn't matter how much you document. If your hospital has to set up with the cardiologist, are the ones submitting the interpretation into Muse Web or whatever, they're the ones who are going to get that bill for that EKG, no matter how good documentation you do. However, good documentation of the EKG does give you more points in the decision making. So it's still a good thing to do, but it won't be billable. So if you order a rhythm strip and the nurses plant an EKG and drop it on the chart, even if you didn't put the order in, the nurses and the techs are instructed to then put the order into your system, and therefore you won't get paid no matter how good a job you do. So you got to make sure that they don't get an EKG during that visit, only a rhythm strip. And you have to have a specific order on the record. It can't be that the nurses put them on cardiac monitor. If you put ED cardiac monitor and they just happen to print a strip, that's not a true order. Their order has to be for a rhythm strip. And on your documentation, and again, I go into detail on this on the course, there's actually one of the chapters about EKG rhythm strips. You have to put an rhythm strip order was placed. The reason was due to palpitations, low heart rate, chest pain, or whatever. And then your interpretation has to have those three elements for it to be billable. Now, here's the cool thing. If you do it right and they didn't get an EKG, you don't need to be specially credentialed to submit this bill, number one. And number two, you can do it twice. So if the patient comes with tachycardia and 130s and you drop their heart rate and now it's 100 and you document again, you get to bill for the EKG rhythm strip interpretation twice, which actually leads to a pretty good RVU monetary reimbursement for that interpretation. So it's worth doing if you do it right. But some places will require that the nurses print the rhythm strip and put it on the chart as an actual order and tape it. You know, some places they tape it to the chart and paper and get scanned into the record. But there has to be evidence that there was an order placed by you for a rhythm strip, what the indication for that order was, and then the interpretation for you to be able to bill for it. And again, if the nurses end up doing an EKG instead of a rhythm strip, now the EKG is going to get sent to cardiology, and then they're going to bill for the EKG, which means your rhythm strip, no matter how good you did, is not going to be billable. So one of the comments on these threads said, oh, is it worth doing? It doesn't lead to too much. It can lead to quite a bit, actually, because it's like $15 per rhythm strip. So if you do two of them, it's $30. And if you do that a few times a shift, so you're talking about quite a considerable amount of money that you could be generating that you're leaving behind on the table if you don't. So hopefully this answered the questions. Again, I go into this in a lot more detail, exactly what the documentation elements are in my RVU optimizing course, which I'll put a link if you guys want to check it out. All right, take care, guys. Bye-bye.